Okay, today I'm going to attempt to answer the question of which is better, a dental implant or a dental bridge. So in case you don't know what a dental implant is, it's a titanium screw that has multiple parts, and when it's in your mouth, it is a one-to-one replacement of your missing tooth. And in case you don't know what a dental bridge is, it is essentially a ceramic or a porcelain fused metal lab-made device. It's essentially like 3 crowns that are glued together, and it's permanently cemented in your mouth and you can never take it out. Now there's advantages and disadvantages for each of these, and I'm going to go through them one by one so that you can fully understand which one is better. And for your situation, it's going to be different than other people. Just because it's better for you doesn't necessarily mean that it's better for somebody else. So, okay, let's start with a dental implant. How a dental implant is better than a bridge. A dental implant is actually going to preserve the bone. So when we remove a tooth, that bone is going to shrink up and is going to shrivel away unless we A, bone graft it, or B, place a dental implant. If you're doing a dental bridge, your bone basically shrinks down to approximately 33% or less of the original bone that you had. So a dental implant versus a dental bridge actually preserves your bone. A lot of times when we do these implants, we're actually going to bone graft that area, which holds that bone at a larger volume, which essentially gives you more options in the future. And a lot of people also like that dental implants can't get cavities. They like that you don't have to worry about a cavity coming underneath it and it needing to be replaced like a dental bridge. Another cool part about a dental implant is that if we need to retrieve it, it has a bunch of different parts, so we can strip off the top part, which is a crown, and access it and change it and give it different parts, give it a bigger crown. Let's say your crown breaks, we can just unscrew that crown, throw it away, get another crown, screw it right back in, and voila, you have another crown. And one of the biggest advantages is that you do not have to drill on the adjacent teeth. So the adjacent teeth are the teeth next to the missing space. With a dental implant, you don't have to drill down that tooth. You're just placing an implant in the bone and you're not touching the other teeth. With a dental bridge, you do have to drill down these teeth into little stubs, which if they're not already drilled down to stubs, it's not really the best idea to do. Another advantage is that a dental implant is more like a real tooth than a dental bridge. A dental bridge, you cannot floss up and down on the bridge because you have 3 crowns essentially that are splintered together. It's a permanent restoration and you have to floss underneath the bridge and use a little pick and pull it through. With a dental implant, you don't have to do that. You just floss up and down just like a normal tooth. Now, when it comes to the teeth in the anterior or the front of the teeth, let's say you're missing your front tooth, dental implants are always my go-to. I always want to try to do a dental implant for a couple of reasons. Number one is they look a little bit better. Compared to a dental bridge, implants generally look better because of the way the gum is formed on your front tooth. There's also the other part that if you don't have the other 2 teeth as crowns and you're missing your front tooth, a dental bridge isn't going to be the best option because again, you have to drill on the adjacent teeth or the teeth next to the missing space. Another thing about dental implants is that they are not reliant on the other teeth as anchors. Sometimes dental bridges have 2 anchor teeth, and if one of the teeth is angled a little bit, it might hurt when you're biting down on it, and over time you might have problems. But with a dental implant, you don't have to do that. You're basically taking that missing space, placing a dental implant in there, and now you have a very solid, strong tooth that has been studied for decades and is actually a really nice replacement. Another nice thing is that it's easier to maintain than a bridge. Like I was saying before, if you have a dental implant, the biggest thing is you need to floss it, and you need to floss it a little bit differently than a bridge. You just go up and down, make sure you're getting at the base of it, and that's what you need to do to maintain that dental implant. Now with a dental bridge, it's a little bit more complicated, and I'll get into that in a sec, but it's easier to maintain a dental implant generally than a dental bridge. And the last advantage of an implant versus a bridge is that it's very versatile, so you can change it out. Let's say there's a new technology down the road, you can swap out the parts and get a new crown. Let's say you break your crown, you can replace it. Let's say you want to change the color of your crown, really easy to do. It's not cheap, but you just unscrew that crown or destroy that crown if it's cement retained and you put another crown on there. And you can do that with the dental bridge. It's just much, much more expensive. Now let's talk about the advantages of a dental bridge versus a dental implant. A lot of people end up getting dental bridges over implants in my experience and in my opinion because they're covered by insurance a little bit better, they're a little bit more mainstream, and they're quicker, easier, and they're a little bit cheaper to do. If you look at the cost of a dental implant and a dental bridge, in a apples to apples comparison, the dental bridge is always going to be slightly less or a large amount less compared to the dental bridge. There's also the time it takes to do the dental bridge. An implant might take 4, 6, 9, or 12 months to do a dental implant, because dental implants require on the bone to actually heal around the implant. Sometimes they fail, sometimes they need more time to heal, sometimes the bone does not heal as you want it to, and the dental implant is going to actually be a faster thing to get. So if you're in a hurry to, let's say, fix your front tooth, the dental implant is much slower to do than the dental bridge. Generally, dental bridges are going to be 2 to 4 weeks. If you're not waiting on healing time, that is the quickest that you can get a dental bridge, is about 2 to 4 weeks. A dental implant could take upwards of a year. Let's say it's your front tooth, we have to bone graft, we have to have a temporary. It can take upwards of about a year for a dental implant, which is a huge disadvantage of that compared to a dental bridge. Another reason you would want to get a dental bridge versus a dental implant is the fact that dental bridges are made for people who don't have risk factors against dental implants. What I mean by that is some patients are at high risk of a dental implant failing. Smoking, uncontrolled diabetes, diabetes that is controlled. Certain risk factors prohibit me from recommending this from patients. I don't really like to recommend this for patients sometimes because they have a high risk of dental implants failing. And if you have a high risk of it failing, that means you're gonna pay a lot for something that could fail in the future. And you have a dental bridge option just sitting over here, and in that instance, that dental bridge is going to be probably a better option for you. So ultimately, it is a case-by-case determination whether you should get a dental bridge or get a dental implant in your mouth. You need to talk to your doctor. Of course, they're gonna know exactly your situation, your x-rays, your bone level. There's so much detail that goes into this. Don't take my word for it just from somebody on YouTube. I'm not your dentist. Don't ask me specific questions about your mouth. I can give you generalized information, but this is just a starting point so that you have the dental IQ or the dental knowledge so you can go to your doctor. So you can talk with them on a level that is very, very high. You're very sophisticated now in dental implants versus a dental bridge. And hopefully this information helps you make a better decision on whether you need to get an implant versus a bridge, because every situation is different. Every patient is different. Everybody's financial situations are different. So what works for you may be better for you, but not so great for the patient next door or your neighbor or your family member. So it is a case by case. So remember, it's case by case. It's not a one size fits all type of thing. And if you have other topics on things that you want to cover, leave them in the comments below. Or if you've had a dental implant in the future, or if you've had a dental implant and you don't like it, you regret it, and you wish you would have done the bridge, please leave that in the comments below so that other people can see it, so that I can read it. So hopefully other people can learn from your mistakes. I'm just a dentist. Thanks for watching. Check out some of these other videos that I have on Zin, on smoking, on gum disease, on how to get rid of stains, how to get rid of calculus. If you're into that kind of stuff, subscribe to the channel as well. And thanks for watching.